Vitamin B12 deficiency is pretty common, especially among people who avoid the consumption of animal-based foods, as they're the only natural sources of this important vitamin. Seniors, vegetarians, athletes who regularly perform exhaustive workouts, and patients with certain health issues are at a higher risk of developing vitamin B12 deficiency. In the United States, approximately 6% of adults younger than 60 years are deficient in vitamin B12, while the rate is closer to 20% in people older than 60 years. Common adverse effects of vitamin B12 deficiency are anemia, fatigue, dementia, impaired physical performance, and even infertility. So, vitamin B12 supplementation may be beneficial in many cases. The recommended daily intake for adults is 2.4 micrograms. Only pregnant and lactating women require higher dosages. Healthy people who are afraid of not getting adequate amounts from their diet could take 1,000 micrograms of vitamin B12 from supplements once a week. As vitamin B12 is a water-soluble vitamin with a biological half-life of less than a week, it has low toxicity. Even much higher dosages are considered pretty safe because the body doesn't store excess amounts. In fact, most dietary supplements contain between 500 and 5,000 micrograms of vitamin B12 per tablet. Keep in mind that we absorb only a small portion of vitamin B12 from supplements. It's estimated that we absorb 2% of vitamin B12 at doses of 500 micrograms and only 1.3% at doses of 1,000 micrograms. Hence, it's better to split your weekly dosage into 2 to 3 parts. Healthy people who follow a well-balanced diet could take a 500 micrograms dose, while people older than 60 years may benefit from the consumption of a 1,000 micrograms dose twice a week. Much higher dosages, although safe, are rather unnecessary to healthy people. But in cases of acute vitamin B12 deficiency, due to poor diet, disease, or impaired oral absorption from supplements or food, vitamin B12 shots may be necessary. Vitamin B12 injections bypass potential barriers to the absorption of vitamin B12. It takes about 72 hours for vitamin B12 injections to work. Every person reacts differently to vitamin B12 supplementation though. In any case, you should consult your healthcare provider before taking a vitamin B12 shot or even dietary supplements. Athletes also need high amounts of vitamin B12. However, if they consume a balanced diet that includes milk, dairy products, meat, chicken, fish, or eggs, a weekly dosage of 1,000 micrograms is more of a preventive measure. Otherwise, if the consumption of animal-based foods is limited, it's recommended to take at least 1,000 to 2,000 micrograms of vitamin B12 from supplements every week.